Particularly Vulnerable Families group just wanted to say how brilliant you've all been. So I just want to share that. Thank you all.
Oh,
Great. Good afternoon, everyone, and welcome to the Independent Sage briefing. We all should be able to breathe safe air with minimal risk of infection or pollution damage. And today we're dealing with this crucial public health issue, how to keep our public and workspaces and schools safe. COVID restrictions have lifted, isolation is no longer necessary, and a lot of us are moving around like we used to pre-pandemic, but the risk of transmission and infection is still present, especially for the 3.7 million of our citizens who are clinically extremely vulnerable. Now, we can't all work from home. Most of us must be present at work in person, and we cannot avoid populated spaces. So we need to come up with solutions to make these spaces as safe as possible. And it's in that spirit that, with the backing of several unions and associations, we at Independent Sage today are launching the COVID-19 Safety Pledge. This effort was started by Professor Stephen Reicher and has already received the support of many, including the British Medical Association. He's going to give you more details, bring in some great guests to discuss these crucial issues of safety. But first, it's over to Dr. Deepti Gurdasani to present the latest numbers. Deepti.
Thanks, Anthony. I'm hoping that you can see my slides. So yeah, I'll just go through the basic numbers for this week, starting off with cases. This is from the Office for National Statistics survey, and cases are now declining in all regions, which is good. But we need to remember that case rates are still very high. So, they're still higher than, say, December last year. And the prevalence between different nations is 2 to 3%, which is quite a high prevalence for infection. The declines are also across all age groups, but the prevalence appears to be still higher among the older age groups. So the prevalence is highest now among the 50+ age group, who are also obviously more vulnerable to severe disease. In terms of hospitalizations also, we are seeing the same pattern. We are seeing drops in hospitalizations across all nations, but we are still seeing, so this is number of patients in hospital with COVID, about 6,000 to 7,000 people in hospital in England with COVID, which is still not a small number. It's still quite high. Of these, about 40% had COVID-19 as their primary cause. This doesn't mean that the other hospitalizations aren't important. They may be contributing to admission, or they may be infection acquired within hospital, or they may be incidental. Worryingly, if you look at new admissions, then, or rather new patients in hospital with COVID, about 17% of them seem to have developed COVID within hospital rather than in the community. And that is really worrying in terms of infection control. If we look at NHS capacity in general, and this is bed capacity. So we need to remember that the impact of the pandemic, it is not just cross-sectional when there are surges, it's cumulative. And you can see that clearly when you look at bed capacity, which is different from staff capacity, which also matters. But here what we see is that the proportion of unoccupied beds that we have is lower than at the peak of Omicron, which seems counterintuitive. But if you think of it in a cumulative sense, it suggests that the impacts of the pandemic are now being seen. And you can see this even in terms of waiting times for treatment. So there are now more than 6 million people waiting for routine treatment. And that's 1 in 9 people in our population. So it's huge. And of those, about 5% have been waiting for more than a year. So these are not short waits. If we look at deaths are also now declining. So, we're reaching the point where we almost have 196,000 deaths on the death certificate involving COVID, and more than 18,000 have happened this year alone. But we're still seeing a significant number of deaths. So we're still seeing over 100 deaths per day, which is not a small number at all. And if you look at this impact, is disproportionate. So, if you look from people who have no disability, have some disability and are the most disabled, you see a gradient in the risk of death, and the risk of death is 3 to 4 times higher among those who are most disabled. And, worryingly, this is not something that has changed over time. So it's not something that's changed, for example, the vaccine rollout or booster rollout. While overall, yes, the death rates have reduced, the differences have not.
Oh.
In terms of vaccination, I think the plot is pretty much the same that I think is shown every week. We still have 1 in 5 people completely unvaccinated and about 60% of people boosted. So there's still a significant population that's not boosted or not vaccinated at all. When we look at the 4th dose, which some groups have been eligible for, about 2/3 of 75-plus-year-olds in England have received this, but there's a huge difference across different nations, with Northern Ireland being the lowest. And looking at vaccines in children, I mean, this is woefully low. So if you look at 2 doses, for example, in 12 to 15-year-olds, only 37% of children in England, for example, have received this. And if you look at 5 to 11-year-olds, 7% have received 1 dose. But if you look at 2 doses, only 0.2% have received this, which makes sense given the gap between the first and second dose and the number of children recently infected. But it's much, much lower than the median value across the EU, which is 15% for 2 doses in 5 to 9-year-olds, and also much lower than Israel, where 18% have received 2 doses now. So huge disparities there. If we look at behavior and sickness, then we find that this has changed, and steadily, the number of people who are self-isolating has steadily declined over this year, with about half the people doing this now. In terms of mask wearing, also we see the same pattern, with about 44% now wearing a mask outside the house. While symptomatic or during the self-isolation period. If we look at mobility, then what we find is mobility in some areas is still below the pre-pandemic level. So if you look at things like retail or transport and work, it's clear that some people are still continuing to be cautious. But what is the impact that the pandemic is having in terms of sickness? Because sickness has impacts on society and on health. And this is data from the Office for National Statistics that shows that at least up to the end of 2021, sickness absences have been rising during the pandemic. And this is not self-isolation, it's just sickness absences. And if you look at absences by different occupations, these follow a pattern based on when, I guess, cases are highest. But even at the lower point, for example, after the BA2 wave, you can see that it's quite significant. So it kind of varies between 1 to 4%. And you see that it's higher in healthcare, social care, teaching, but it's pretty high across the board. So it's very clear that COVID is leading to disruption, whether you ask people to self-isolate or not. And of course, this has an impact on health as well. And you see the same pattern in terms of long COVID in occupations, with people in health and social care and teaching being at the highest risk of long COVID. So to summarize, cases, hospitalizations, and deaths are thankfully declining in all nations, but we're still seeing a significant number of people in hospital, and it looks like we're seeing a significant proportion of infection acquired in hospital, which is worrying. NHS capacity is still severely limited, and waiting lists are continuing to increase even as cases decline. And deaths, while declining, are still happening in significant numbers. Unfortunately, the disabled form a disproportionate number of those who died of COVID. So, 60% of the deaths have occurred in disabled, who form only 17% of the population. And that's, that's worrying. And self-isolation and masking behaviors have reduced. Mobility has changed with opening up, but is not quite back at pre-pandemic levels still. So there is clearly occupational risk and sickness with all the mixing that we are seeing, and the high levels of transmission we're seeing, which are declining but still high, which is likely to still have cumulative long-term effects on health and economy and workplaces. And with that, I'm going to hand back to you, Anthony.
Thanks, Deepti. That was great. Just a quick question on self-isolation. Clearly, the government has said they're not going to make this compulsory. Do we know the chief medical officer presumably supports the idea of self-isolation? Does he? I don't know. Does anyone know?
I don't know.
We ought to find out. I mean, I would have thought from a medical point of view, it's what we should be recommending. And the question is for how long? I would have said 7 days, but others might disagree. Anyway, we can come back to that. Thank you very much. I'm going to hand straight over to Professor Stephen Reicher to take us through the pledge. Steve.
The pledge, yeah. So I'm really excited to be introducing this today. There are many people who've been involved in doing the work to make this happen. Janet Newsham, who is here, Phil Taylor, who I'm not quite sure if he's here, Dave Moxham, Shirley Asquith, Tracy Edwards, Kerry Williams, huge amounts of work. So thank you very much to them. And almost daily, new organizations are coming on board to support the pledge. So we have multiple trades unions who are working on it, Unison, UCU, and PCS. We have many organizations of clinically vulnerable people or bereaved family, long COVID groups, and we have a number of them here today. And yesterday, and we were delighted, the British Medical Association came behind it as well. In many ways, what strikes me most about the pledge is just how modest it is. I mean, all it's asking for is what should be happening anyway. It's asking that employers do proper assessments to make sure their premises are safe for their workforces and for customers or service users who use those spaces. That's in the law already. We're not asking for very much. And the other thing we're asking for is that precisely that if people are sick with COVID, they don't come to work and spread it to others. My understanding is that is the very clear public health advice. Certainly it is in Scotland when the obligation was taken away. The spokesperson, Jason Leach, said absolutely clearly, the public health advice has not changed one little bit. It should be happening. So what we're asking for are the things that should be happening anyway. What we're asking for is what the government should be doing to ensure these things happen. And it's only because the government has abdicated its responsibilities that we're doing it for ourselves. But we will do it for ourselves, and we will keep ourselves safe. And we will see today what a powerful coalition and a powerful set of arguments we have. But before we go into that, first of all, Janet Newsham from the Hazards Campaign is going to explain the pledge, what it is and how it works. And she has a PowerPoint to make that easier. So Janet, and your PowerPoint, can I invite you to speak next?
Yeah, thank you very much. And hopefully the PowerPoint will appear in a minute. So I'm pleased to present the pledge to you on behalf of the coalition of organisations, including the Hazards Campaign. We're still in the middle of a pandemic. We are still seeing lots of people dying from COVID and lots of thousands of people being left with chronic ill health and disabilities as a result of it. I don't know, is the pledge on the screen yet? No. Oh, yeah, just coming on the screen. Thank you very much. So despite our government's negligence, as already been said, then we need to continue to protect ourselves and each other, as Stephen has indicated. And the pledge is simple. It's nothing new. It's what should happen in terms of health and safety law, and it's what should happen in terms of protecting each other in terms of public health. So next slide, please. So why do we need it? Well, we need it because it's good for workers. It will improve their safety at work, it prevent infections. It's what we should be doing in workplaces. It's good for the public. It should give us confidence to go into shops, into premises, and into to use other services. And it's good for employers. And hopefully we'll be more likely to use their services, use their premises, buy their products if they are protecting people in their environments. Next slide, please. So how do you sign up to the pledge? Well, we want employers to talk to the trade unions. We want trade unions to talk to the management. We want people to talk, where there's no trade unions, to talk to their employers. And we want an agreement on what that pledge means to you. You know, what measures need to be put in place for the safety of workers and for the people that use their services. And we want you to go to the sign up page on the COVID pledge, www.covidpledge.co.uk. And we want employers to make a public declaration. So, you know, on their websites, in their windows, in their workplace and the premises. So make a public declaration that people can see what's happening. Next slide, please. So how do you support the pledge? I mean, if you're a user of a service, if you're going into a shop, then please ask the owner of that premises, ask the manager of that premises if they are supporting the pledge. Make sure that we're talking about it wherever we are and wherever we're visiting. If you think there's some good practice out there, then contact us using the covidpledge22@gmail.com email address and give us some examples of what's going on. But also we want to know what bad practice is going on. So who are the bad employers? Who are the bad premises? You know, and let's expose those or put pressure on them to make sure that they're protecting people that go into those premises. Next slide, please. And so who's promoting the organisation to the pledge? Well, these are some of the organisations involved, and there's other supporters Stephen's indicated. So some really powerful organisations supporting it from the community, from our trade unions, professional bodies and health and safety organisations like ours. And finally, next slide, please, sorry. And I wanted to say that the Building Engineers Services Association, who are involved in assessing ventilation, etc., in our buildings, who's saying, but you know, are involved in what we should be putting in place and to mitigate against infections of an airborne disease like COVID is. So by assessing and controlling infection risks, including improving ventilation and filtering air infections, how they'll be controlled. And Graham Fox said, improving indoor ventilation reduces the risk of transmitting diseases between people. So investment made now can have significant long-term economic and social benefits. And the other quote here is from Kim Sunley, who's the National Health and Safety Officer for Unison, one of the biggest trade unions in the country. And Kim Sunley says, for far too many workers, sick pay policies have forced them to choose between following COVID-19 guidance or putting food on the table. Adequate support to stay at home is essential and should include decent sick pay provisions. Next slide, please. So I urge all decent employers, business owners, service providers to continue to assess and control the risks from COVID-19 infections and sign up to the pledge and publicly say that you will continue to do all you can, despite what the government's saying, in spite of what the government's saying, to do all you can to prevent further infections and support your staff and others. Thank you.
Okay, so thanks very much indeed for that, Janet. It's very simple. We've designed the pledge to be very simple, so there aren't many hurdles. All it requires are for employers and employees come together to agree that they want to carry the pledge forward and to discuss what it means in their organisation, and then go to our website. And I'd particularly like to thank Dave Mopsam and the STUC. The STUC have given us amazing support. As ever, Scotland is ahead of everyone else in the UK. Perhaps that's a bit chauvinistic of me. But anyway, thanks to Dave and the STUC for their work on the website. Simply go to the website. There's an online form. You can fill it in, and that way you will then be displayed as supporting the pledge. So as I say, very simple, no hurdles. We want this to be something that works, that goes as wide as possible, so people can genuinely see those pledge signs up in the windows and know that measures are being taken to make them as safe as possible, and in particular that they will not be served by people who are infected with COVID. So what we're going to do now is to talk to two of the sectors which are particularly important in relationship to the pledge. First of all, I'm going to talk to Tracy Edwards from the PCS, and then secondly, I'm going to be talking to Imogen Dempsey from the Clinical Vulnerable Family. So to look at this from a workforce point of view, because we're talking about their workplaces, and then talk about this from a public point of view, because of course this is particularly important for vulnerable people, so they know they are being looked after when they go into premises. So first of all, can I start with you, Tracy? I said something at the beginning about the fact that a lot of what we're asking for is in fact a legal obligation under health and safety law. So can you tell us a little bit more about the nature of those legal obligations of employers, what they are, and are they being upheld or not?
Yeah, thanks very much, Stephen, and thanks very much for the invite to attend this very important meeting. Well, to set it in context, what we have is the Health and Safety at Work Act, which was introduced in 1974 off the back of a number of work-related deaths and accidents that had taken place around that, running up to that time, where trade unions and safety campaigners campaigned vigorously for a change in the law. The Health and Safety at Work Act still exists, and what it is it places a legal duty on employers to ensure and to uphold health, safety and welfare for all of those people that they employ, and that includes extending that to the health and safety of any visitors to any of their premises. It's very much through a principles of prevention approach and risk assessment approach, replacing the dangerous with the less dangerous, not introducing measures that place people at risk or harm. And in trade union recognised workplaces, they're also required to consult with trade union appointed safety reps, act on health and safety concerns brought to them by us, and to allow access to trade union reps to carry out inspections and to consult with our workforce. There's also regulations covering how health and safety should be managed in the workplace through the management of health and safety at work regulations, which came in 1999. So really, it's all very simple. It's all set out there. It's very easy to follow, and it's a real framework that we can all use. But to answer your question, Stephen, unfortunately, no, it isn't. They aren't being upheld. And at a time when we've had massive pandemic, this should exactly have been the focus that employers were focusing in on, and the approach that they needed to take instead of the confusing and the authoritarian language that we got from the government, and of course employers relying on that.
So in other words, we're in that strange situation where we're having to ask of employers what we're asking of our government, which is simply that they obey their own laws. It seems a little bit ironic, but how will the pledge help, do you think?
I think the pledge will help because, again, there has been a lot of confusing messages coming out from government. We haven't had enough enforcement, or there's been a lack of enforcement regulation by the Health and Safety Executive. A lot of people think that the legislation is quite confusing, and that perhaps health and safety is something that's technical. But I think that what the pledge can provide is a common programme and framework for us all to unite around. Which is easily understandable and which everyone can agree with. It's also an opportunity for us to raise awareness, work with those decent employers who recognise the important role of health and safety in the workplace, and to push for improvements elsewhere. I think it's also helpful in order to keep health and safety on the agenda. Obviously, the government would like us to believe that it's all over. We're living with COVID, but as we know, this is only the start. We've got the Brexit Freedom Bill coming up, which is going to strip away further rights, and really the government perhaps try to claw back the money that it's spent dealing with the pandemic. They're going to take it out on us, and then the civil service, we're feeling that quite sharply with the announcement of 91,000 job cuts. But I think it encourages and supports workers to come together to collectively discuss health and safety, but also how work is managed, which is having a huge impact on the health and safety of workers across this country, and you know, in the case of mental health and work-related stress, to build on the knowledge that we've gained over the pandemic on the importance of ventilation and air quality, and to challenge those HR policies that are penalising workers for being off sick, and to build more worker and workplace and community solidarity on all this.
So let me finish with a very practical question. What will your union, what will the PCS be doing practically to promote the pledge?
Yeah, the first thing we're going to do is we are going to work in collaboration with the British Engineering Services Association on putting together some proposals that we want to put to the Cabinet Office in order, in terms of the civil service estate, a long-term plan on improving building safety, on improving ventilation. The second thing that we will be doing is that we'll be also seeking support from our sister trade unions and the civil service around this as well. And we're also got very good timing as well. And I'm really pleased that Independent Sage are emphasising the need for worker involvement, because this is going to really complement our existing work with our health and safety reps. And, you know, we can use it to gain buy-in from the workforce and to really encourage, you know, more discussions around this. We've just in the past couple of weeks submitted the pledge to the British Museum, and we did that in collaboration with our members. We took a vote on it, so we've got a mandate from our members on this. But I think that, you know, it's a fantastic meeting today, and the key thing is you know, the necessity to recognise that we need to get, you know, everyone behind this to enforce existing health and safety rights, but to also redress the balance towards healthier workplaces. It's not only in the trade unions' interest and everyone's interest, but I think longer term, if we're to sort of reverse the sort of pandemic of you know, work-related stress, which is costing the economy £37 billion a year. I think that improving health and safety in particular is also in the employer's best interest as well. So thank you very much for having me, Stephen.
Yeah, I love the idea of being in the British Museum, so in 1,000 years people can come and see that not everybody was mad during the pandemic. So thanks for that, and thanks for all the work that you're doing. If I can now turn to Imogen Dempsey. In fact, we were meant to be having Lara Wong, who unfortunately is unwell today. She had a booster yesterday and wasn't up to today. But Imogen is not a substitute. We're just as pleased to have you here today, Imogen. Many people, as we've heard, and we hear time and time again, are talking and acting as if COVID is all over and that there are no issues anymore. And that, of course, ignores the experience of those 3.7 million vulnerable people and what it means for them. So can you tell us something about the reality of the experience of clinically vulnerable people at this point in time?
Thank you for having me on today, Stephen, and to all of IndySage for giving a voice to clinically vulnerable people trying to live through COVID. The experience vulnerable people have had is kind of mixed depending on the setting. Some settings have got a lot more mitigations in place than others, for example, healthcare settings. Many of our members in the clinically vulnerable families group have not eaten inside restaurants for over 2 years and are now put off the idea of even ordering takeaway or getting delivery, because there are reports now that some places are asking staff with COVID to still come to work. And when companies are asking staff to come in even with COVID, how are we supposed to learn to live with COVID if we can't avoid it? Where is the learning? You know, we hear comments like, if you're just that worried, just stay indoors then. Well, for us, that's quite isolating. You know, we've done that for most of the last 2 years. We've tried to keep ourselves safe, but it's harder to do that when we know that financial support is not there for many employees to isolate, so they feel like they have no choice because, you know, as previous people speaking have said, you know, food needs to be put on the table for their families too. And we need to be doing whatever we can to reduce the spread of infection. And as mitigations have been dropped by government, like masks, which are an effective measure against an airborne virus, it's harder than ever to keep safe for people like me with no immunity, because we're still at higher risk. And many of our group members are being asked to return to work face to face. And it's kind of a grim choice between earning and trying to preserve health. And many of us are already juggling chronic conditions. It's a real lives or livelihoods issue.
See that? I mean, it's an impossible choice, isn't it? Your livelihood or your life. We shouldn't put anybody in that position. So, can I ask you the same question that I asked to Tracy? For you, what difference will the pledge make? How will it help?
I think it will make a difference to the 3.7 million clinically vulnerable people, because that helps us to make a really informed choice as to where we spend our money. The pledge is a really important layer. People are going to vote with their feet, who's got the pledge displayed, which shops and supermarkets have signed up. We want to support businesses that are working safely, of course. It's a really important step. Alongside that, for vulnerable people, we also need the things that the government have announced but have not yet actually put in place. And that's things like filters in classrooms, HEPA, and things like new treatments. For example, there's one that was announced nearly 2 months ago now, but people still can't actually access it. So there are things that the government says that it's doing, but are not actually happening in practice. So the pledge will make a difference as to what clinically vulnerable people can do for ourselves. But again, that's part of a broader structural picture.
I mean, that's really interesting, isn't it? We hear the headlines, they say they're going to do things, but we don't hear about the realities on the ground. And I think your point about information is critical. I mean, the government talk all the time about people making their own choices, about people using personal responsibility. How on earth can you do that unless you've got the information on the basis of which you can make those decisions? And as you say, hopefully the pledge will help give that information. And again, let me ask one final question, and then I will throw it open to see if there are any more general questions from the panel. What should clinically vulnerable people and the general public do to promote the pledge, or rather what can be done to promote the pledge?
Well, it'd be great to see everybody getting behind the pledge, clinically vulnerable or not, by choosing to support those businesses that have the pledge displayed, by sharing it, by sharing the website, by asking the businesses that don't have it displayed, well, have they looked at it? I know clinically vulnerable people will want to support the businesses that are working safely. So I'd be really keen to see lots of shops and supermarkets and restaurants signing up to that.
Well, that's a brilliant question, isn't it? To turn it around and say, well, look, if people aren't signing the pledge, what are they saying? Are they saying that they do pressure their own staff to come to work when they've got COVID? How can anyone justify that? Or are they saying they're not going along with health and safety law and assessing their premises and making sure that they are safe, properly ventilated, and so on? So yes, the question should be turned round, shouldn't it? And be, what on earth are you saying if you say no to the pledge? But let me throw it more open, because on the panel, as you saw, we have a very wide range of organisations behind the pledge. We didn't have time for everyone to speak, although we would really like to have heard from everyone. But I wonder if there is anybody in particular who wants to add a key point that hasn't been made, or to ask a question to anybody who's spoken.
Ondine has her hand up.
Hi, thank you. And thank you very much for inviting me. Yes, on behalf of people with long COVID, I would say I would like to echo many of the things that Imogen has already said. People who've got long COVID, still suffering from it, are very, very averse to reinfection, because it's very difficult to know how a reinfection will impact somebody in this situation. What we're hearing is a bit of a mixed bag of results. Some people claim it they've recovered more after an infection, but many are saying it sets them back. And given the amount of time it takes for people with long COVID to recover, it can be extremely slow. And to lose all of that progress is a really frightening prospect. So I would say we've got 1.8 million people with long COVID in this country. There are many who've recovered who are not counted in that number, are very unwilling to put themselves at risk. And it's equally frightening. I know many, many people with long COVID who don't want to go out and don't want to go into indoor premises because they're scared that people will pass the infection on to them. So I'm really hoping that this pledge will be widespread, that it will give people some confidence to be able to go out, and that it will spread amongst the public as well, so that people in these premises will feel more comfortable wearing masks or keeping their distance, to be considerate to people who've got long COVID, some of whom, of course, are returning to work and are in workplaces which are not that safe for them. Thank you.
Thank you, Ondine. I can see Phil Taylor's hand up.
Yes, great. Thank you very much, Independent Sage. I mean, I've been part of the coalition that's put this together after Stephen's initiative. I just wanted to say a few things. First of all, I think what is really important about the pledge, or the first thing that's really important about the pledge, is the very fact that it exists and will be visibly displayed will challenge the horrendous narrative that we now live in an era where the government is talking about restrictions, has talked about restrictions, whereas we want the narrative to be about protections. It's as simple as that. So there's an ideological hammer that comes with this pledge. Secondly, I think the pledge will restore that collective social responsibility that society has and has attempted to be fragmented by the it's all up to you, the individualism of whatever decisions you take. The third thing I think it does, it will help monitoring not just work environments, but all premises environments as people get behind it. We are in a period where people have been driven actually in the case of the civil service back to work and so on, with all the implications that come from that. The fourth thing is, we're doing this now at the moment when the statistics presented earlier on were bad enough. But what happens if we get another mutation? What happens if we get another variant? What happens if we're in the period of epidemic again, serious epidemic again? The pledge can make a real difference to this. And I think the final thing is just an operational matter. In unions, we have a whole network of health and safety, skilled health and safety activists who can take this up and be an agent for change around this. Customers, consumers can also be part of this collective thing. And therefore, what the pledge gives us is a very visible, simple, accessible tool for millions of people. This is our ideal, isn't it? That can be picked up, used, taken to shops, pubs, premises, workplaces, and so on. We want to get momentum behind this.
Thanks, Phil. Those are really powerful points. Let me then wrap up this session before we have general questions, and I'll hand back to Anthony by making a couple of points. One of the key pieces of rhetoric from the government is to talk about freedom and giving us back our freedoms. But of course, as we've heard really powerfully, for 3.7 million people, and many more actually, people with long COVID and so on, they are not at all free to use many resources in our society. Can't go to bars and restaurants and cinemas, difficult to go to libraries, difficult to go to government offices if they don't know that they're being protected when they go there. If we want freedom, we need the pledge. And I think the pledge and displaying the pledge and giving that information is absolutely critical to reopening society in an inclusive way, not just reopening it for those who are fit and well and healthy, but reopening it for everyone. So I think it's a profoundly important at a social level. And my final point is simply to echo something that Imogen said, that we should all get behind the pledge. If you are an employer and you're watching today, please get together with your workforce, go to our website, and fill in the pledge sign. If you are an employee, and many of us are employees, go to your employer and ask them to put together a plan of what they're going to do to meet the terms of the pledge, and again, to go to the website. And if you're a member of the general public, and we're all members of the general public, whether we are vulnerable or not, we all visit shops, we all visit bars, and we all visit restaurants on a daily basis. And so when we go to those places, talk to the managers and the employers and ask them to sign the pledge. And if they're not prepared to sign the pledge, to ask them why not. And if even worse, we become aware of breaches of the very basic terms of the pledge, if we know about places where people are being required to go to work, even if COVID positive, then email us and let us know so we can do something about it. So thank you to everybody for your help, and I look forward to seeing the pledge in the windows and on the walls of the shops and bars and restaurants and offices that I visit in the near future. Thanks very much to everybody.
Thanks very much, Steve. Just before we finish, there are millions of students in colleges and universities, and Aris, I know you're involved with UCU, and what's your view on to what extent universities and colleges are going to buy into this?
So, I know that UCU has written to UCA, which is the employer representative, and asked them to adopt the pledge. They have also provided their reps with guidance and advice on how to pursue in their local negotiations, persuading employers to adopt the pledge, and made public announcements around, for example, that universities should make testing available for free, that they should supply masks and good quality masks where possible. Beyond that, it's a very fragmented sector, and universities will differ greatly in terms of the extent to which they adopt best practice.
Thanks very much. That's helpful. So we're going to go on to questions. We did originally have a couple of questions from the Independent and the Sunday Mirror, but I think they've been drawn away. So I'm in East Yorkshire, and our first question comes from West Yorkshire, which is from Rachel. Over to you, Rachel.
Oh, can you hear me okay?
We can.
Thank you. Well, thank you for inviting me. Basically, I would love to return to dancing in an in-person class rather than doing it on Zoom at home. However, I'm a bit concerned about the lack of ventilation in the rooms where the classes take place. So I'd like to understand how much of a risk there is from a lack of ventilation and how much of a difference it makes. I've been vaccinated. My main concern primarily is about the risk of long COVID, but also obviously other risks, you know, of just having time off work, spreading it to others. Thank you.
Thank you. That's a really important question. It's not just dancing. I mean, I think it's yoga, it's Pilates, it's all kinds of classes. Who would like to respond to that from our panel before I start choosing someone? Janet.
Well, thank you. Thank you for the question. It's really important, you know, in all different settings. And we know how to do that. You know, we know what's needed in our workplaces. We know in any indoor places, we know what ventilation should be. We know that we can improve it by air filtration. So we can bring in other units, additional units to make that space safe, you know, and it might be that they still continue to wear masks in those settings as well. So these are known quantities, you know, and so in all our settings now, we should be asking that person that's running those classes, or the employers or the managers of those areas, what are they doing to ensure that that people are protected in those settings, because it's known quantity how we can improve them.
Well, linked to that, I'll bring you in, Susan. It's just linked to that. My question would be, for a small business running dance classes, yoga classes, Pilates, what's the best equipment they should buy to lower the risk to ventilate and to murder the virus. And how much would it cost? Because obviously there's a cost component. So if anyone wants to chip in on that, but first let's go to Susan.
Thanks. Well, I was going to say that the risk really depends on lots of factors, and for all of us, when we're in different settings, we need to think about how many people are in the space, how long are they there for, how tall is the ceiling, how big is the air around you in terms of density. You just have to imagine there may be somebody infected here. What does it mean for you? The longer you're in the space, the higher risk. The more people per volume of air, the higher risk, and obviously the less ventilation. And I was in a restaurant last night, and they had very tall ceiling, spaced tables, and a big ventilation system you could see right in the middle of the ceiling, and you could feel the air passing through. That's a very different situation than like my current workplace, which is actually a sealed environment, and we don't yet have any guarantee or data about how safe it is. In terms of the air filtration, I think again, this is something where we need, as has been said before, the social responsibility. We need to know kind of what are the better or worse air filtration systems. Myself and my husband did a lot of research and contacted experts we knew, including people who have spoken before on Independent Sage, and in the end did buy an air filtration system, which is about the size of an electric heater. That was sort of more than £200. So that's the information I know. But it'd be great to have a website where, again, people could go to and find out the reviews in terms of what's appropriate for what size of room, what the cost is, etc.
But for £200 for gyms, most yoga studios, Pilates, it is an investment, but you might boost your numbers. But Christina is going to come in on this as well.
Yeah, so in parallel, Independent Sage has been working on a kind of Scores on Doors pilot, which is about businesses and workplaces displaying the quality of ventilation in their places so that people like you, Rachel, kind of know how safe it is to go into those spaces. And we did an Independent Sage session on ventilation in February. And from that, we produced like a 2-page guide about filtration systems, how much you need, how it works, when you need masks, etc. And that's on our website. I've put the link in the chat, but maybe we can tweet it out as well. So that is actually just kind of some useful, just practical tips with links.
Thanks very much, Christina. Anyone else want to comment on this? If not, I'll go on to, Benita, of course.
I think Stephen had his hand up first, Anthony. Don't know if you want to bring him in, Stephen Reicher.
You go ahead and I'll go
Thank
after.
You. Yeah, I just wanted to say that I went through this getting air filtration units for my daughter's school. We actually managed to get HEPA filters into every classroom, and they haven't had an outbreak since January, since they were put in, despite a steady stream of cases. So no rapid spread through the classrooms. I don't have the objective measures, but I'm convinced that they have had a big impact. And it is complicated when you start looking at it. And I'm not an expert, but I did consult with many people who are. And I think there's something about not letting perfection get in the way of progress. So in the end, we did a bit of a back of a fag packet calculation and worked out we'd need two of the larger HEPA filter units in each of the classrooms, and that seems to have done the trick. But we could have gone down that whole route of measuring the ventilation and getting an engineer in and doing all of that. And let's not forget what a simple intervention opening a window is. And first thing I do when I go to any room that's crowded, I open the windows now. And so there are some simpler things we can do that have a big impact.
Back of a fag packet. For ventilation.
That's a respiratory consultant.
Okay, Steve.
Yeah, a couple of quick points. I mean, the first, we quoted the Building Engineering Services Association making the point that good ventilation isn't just for COVID. So some people will say, oh, well, it costs a lot of money and, you know, COVID won't be with us for that long, hopefully. But of course, this is important for the future because it's good in terms of, controlling infectious diseases in the future. And also, and we've made this point before, that actually people's intellectual performance depends upon ventilation. When we have stuffy rooms, actually the studies show remarkable impacts, about 25% impact on simple intellectual tasks, 50% on complex tasks. So we should have good ventilation in COVID or no COVID. COVID just adds to the argument. And the second thing is, Liz Carr, the disability activist, has been arguing for a long time that places should have perhaps, so for instance, theatres should have performances that are mask only and are distanced for more vulnerable people. And that's another very simple intervention you can have. You can have some classes which are designed so that everybody can take part. And again, I think we need to make this point really clearly, that it's absolutely unacceptable to have a society in which we do things in a way that excludes particular people. It's as bad as when in the past you couldn't get into buildings because there weren't ramps. Well, in the context of COVID, having sessions whereby vulnerable people can go in, where masks are worn, where there is social distancing, is every bit as important and should be every bit as foundational as making sure that you have physical access into rooms.
Thanks, Steve. I've got two more questions here, which I'm going to read out together, which is, linked to this. So Margaret Gear says, I own a physiotherapy clinic specializing in long-term conditions. Many of my clients are vulnerable. I take all COVID precautions possible: CO2 monitors, mechanical ventilation, filtration, distancing, lateral flow testing, symptom screening, and funding staff isolation as needed. This is impressive. The Chartered Society of Physiotherapy advises that I can no longer insist that my clients wear masks to protect each other, since it's no longer a legal requirement. I feel that if nightclubs can insist on a dress code, then so can I. My clinic, my rules, excluding those who are mask exempt, of course. Can you advise? So that would be an interesting one. But linked to that, Kate has sent in a question saying, I'm really concerned about dental surgeries, as they're one of the few places where you have to take your mask off. When I went for a checkup a few weeks ago, I asked whether they had any ventilation system installed, and if not, why the windows weren't open. I was told we don't need to do that anymore. Is this really the advice being given by government and or the British Dental Association? I don't think we have any representatives of the BDA, but would anyone like to address either of these? Can she insist a physiotherapist? Helen, let's go to you.
I run a GP practice, and we still insist that our patients wear masks. Other people who come here will be vulnerable, and we insist on mask wearing. Very, very occasionally people object, in which case we'll see them outside. The mask exemptions, people who can't wear masks. There are a few people who can't wear masks. If you need long-term oxygen, it's quite difficult to wear a mask over the top of your oxygen tubes. But actually, there are very few people who cannot wear a mask for medical reasons. I would be really interested in a legal test case that said actually you can't insist that you will only see patients who are wearing masks. I think it is completely reasonable. I know the government is saying we don't need this anymore, but they're not relying on any scientific advice that has come my way or anyone else's way here, I don't think. So I would say I would stick with it if you possibly can. You are doing the right thing in trying to protect both yourself, and you need to stay healthy, to stay working, to help your other patients, and very importantly, your other patients.
Thank you, Helen. So we've got Professor Martin McKee, then Dr. Zubaida Haque.
Okay, so we can look at this in terms of what would be the legal objection to requiring a mask? And the only thing that I can think of, and maybe somebody else can, would be if it was in some way directly or indirectly discriminatory. And I can't see how that would be the case, because as Helen has said, if there are people who have legitimate reasons for not doing it, well, you're going to make allowances for that. So I just can't see how you would actually bring about that. Also, the second question really relates to this issue of, maybe another point is that before the smoking ban came in, for example, many places said that nobody could come in and smoke in a bar or a restaurant, even though there was no legal requirement for them to do that. And that was perfectly legal. There's no problem with doing that. So again, I don't see any reason why not. But I think the other point is about clean indoor air, which is one that we keep going on about and has already been raised. And I just think we need to get a complete shift of thinking, the way that, for example, is happening in Belgium. We talked about it in a previous Independence Age meeting. And in other countries, it just should be the norm that in the same way that you don't have floors that people are going to slip on, you don't have obstacles that people are going to trip over. There are all sorts of things, and clean air should be part of that.
Zubaida, Dr. Zubaida Haq.
Thank you. So talking of British Dental Association, I had this exact example where I went to see my dentist after a couple of years, and I was absolutely staggered to realize that not only did they not have a mask mandate in the tiniest reception room, which was packed, completely packed, they had no air purifiers. But this was the really interesting thing. All the offices where the dental surgeons were in, all those little offices had air purifiers. You had to wear a mask until you took it off. But in the reception area, where also the receptionists and most of the other staff were, there was nothing, no masks, no air purifiers. And I found that staggering. And when I raised it with the manager, which I did, they pointed out that the British Dental Association says that there's no mandate, it's not necessary, and they don't want to force people to wear masks in receptions and so on. But when I asked the staff discreetly, they said they would really like it. And I think that's a really important point, which is staff who are not senior, who don't have that power, are not being protected in those situations.
I just broaden this slightly. On Wednesday, I chaired a parliamentary session run by the Royal College of Paediatrics and Child Health and the Royal College of Obs and Gynae to let MPs, civil servants and parliamentary researchers know all about the risks of air pollution generally on children, on pregnant women, on risks to the fetus, on later health risks. And they'd all been invited. No MPs showed up. No civil servant showed up. One parliamentary researcher showed up. So I've done a tweet thread today, I'm just, advertising that, about what they actually showed, which was pretty staggering, actually. And this is linked. I mean, we've been talking about indoor air. I mean, 90% of the world's children breathe unsafe air, and we're asking for legislation about keeping our targets below 10 micrograms per cubic meter of P20 2.5 by 2030. But anyway, it's just to show you the level of interest of politicians is lamentably low on basic public health. Final question. Last year, this is a quick one, probably for Christina, I think. Last year, the Zoe app, or Steve Griffin, the Zoe app and the government dashboard roughly agreed. Today, Zoe is telling me there are 4,762 active cases in Oxford, while the dashboard says 171. That is, Zoe says 2,700% higher. Which do I believe? How in the world do I make an accurate risk analysis, Christina?
I mean, I don't think you can really believe either, but certainly out of the two of them, Zoe is probably likely to be better now. So when it comes to daily cases, the dashboard numbers aren't that meaningful because hardly anyone is testing. And now with privately bought tests, you can't even register them if you're positive. You can't add them to the website. So there is literally no way right now, if you don't have a stash of tests with the QR code on, that you can tell UKHSA, the Health Security Agency, that you've got COVID. So if you want to keep track of how many infections are in your area, it's things like Zoe, it's the ONS infection survey, which comes out every week and does have a regional breakdown. If you go to their website, you can actually go quite detailed, or look at hospitalizations, and that's about it. And it's sad that we're kind of in that situation, but it is really hard now to get real-time data on where infections are here.
Anyone? Stevie G?
Yeah, I mean, I think that all this refers to, and linked with the pledge as well, is that prevalence really isn't something we should be ignoring, because prevalence, I think even with the dip in cases that Deepti described today, there's still something around 1 in 45 people were infected with COVID last week. Okay, so go into your classrooms, go into your university lectures, go into your shops. There's always going to be someone in there, which makes this pledge so important. But prevalence is what's making clinically vulnerable people have to stay at home. It's what's driving long COVID as an absolutely dreadful crisis. It's what's causing illnesses in children more frequently. And ultimately, it means that as our vaccines wane, we're forced into another cycle of boosters. And really ignoring this prevalence is not living with this virus whatsoever.
Thank you. Duncan, anything to add?
Just in terms of when potentially a new variant of concern comes along, we're going to be taking a long time to actually realise that that's here. And I think, the sort of forecasting we could get with people registering positive tests, I think we don't have. So the risk is a new variant comes along, which we only learn about sort of looking in the rear view mirror rather than ahead. So prevalence is very important.
That's a really important point. And I noticed yesterday that both cases and deaths have gone surging upwards in the United States of America. And I don't know exactly what that variant is. I think it's BA2.1, 2.1 or something, according to Christina yesterday. But yeah, new variants are going to come along, and absolutely right. We need to be prepared for this. Anyway, we're at time. Thank you to all the guests today, all the union members who aren't present but made this launch possible and a success. Thank you to all the questions from the public. Next week, we're having an open session just on answering your questions. So please, if you have any questions you would like answered, either send them to the website or DM them or whatever, however you send them in. And we look forward to answering, because there's so many questions that are of interest to public health, to COVID, to virology, to treatments, to prevention, et cetera, et cetera. So see you all next week, same time, same place. Stay safe and keep well. Bye.
Bye, folks.
Thanks, everyone. Great session. Bye.